Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. This program focuses on healthcare issues relevant to you, your family, or friends right here in Kingman. I hope you'll stay tuned because I've got a great guest on the show today and we'll have a lot of new information for you. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Bhrata Reddy. He's a family nurse practitioner and it has filled a lot of other roles here at KRMC. Thanks for being on the show today, Bhrata.
Thank you for having me.
So, you've only been in Kingman for what, about a year and a half now?
Not yet. I came mid-November.
Oh, okay, so coming up on a year. Very good. Before Kingman, where were you? What did you do?
Before Kingman, I was, for a few months, I was volunteering abroad.
Okay.
With different organizations, and before that I was working in the Bay Area.
Oh, okay,
San Francisco.
Bay Area, okay. So you're a family nurse practitioner, that's your initial training, if you would?
Well, I did all my 3 masters at the same time.
You did 3 masters at the same time?
Yeah.
Wow. Okay, I'm impressed. What were the different masters in?
One was a family nurse practitioner, so I'm board certified and I'm registered.
Okay.
But so the second master's was an MBA.
Oh, okay.
Business master's.
Business, okay.
Yes, and then the third postmasters is a nurse executive.
Oh, okay.
Yes, so a nurse exec is like hospital management.
So chief nursing officer kind
Correct.
of thing, could move into that. Well, you know, the first thing I thought of when you were saying that is how awesome that is that you took a business side as well, because so many healthcare professionals that I've heard of and have talked to, they go into healthcare, but they don't know anything about business. And especially if they have a practice, you know, for a physician, that's a challenge. You know, they have learned everything about taking care of patients, but not so much running an office. And that's, of course, one of the advantages at KRMC, because we've actually employed these physicians now. We have quite a few. I think there's almost 60 now that are employed physicians. So we take away all of that from them so they can focus on just providing for their patients, and then we run the office for them. Makes it a little easier. But it's very impressive that you got that business degree as well.
Right.
And you did all 3 at the same time.
Yeah, save time, but not money.
Oh, you had to pay the same amount whether you took them all or not. Wow. So, did you do that education here in the U.S. or where did you get?
Okay. At Stanford University.
Okay.
And then when I graduated, I wanted to make sure that I feel confident about my clinical skills. So I worked as a nurse practitioner.
Okay.
But it was heart failure transplant.
Oh, wow.
So a lot of that. And once I was
out east,
in Ohio.
Oh, okay.
Cincinnati.
Okay. Yep.
And then once I felt that I knew what I was doing and I was confident about the clinical side, then I moved over to use the other 2 degrees, the MBA and the nurse exec.
Okay.
And I started doing this work of running units and administration, management, leadership.
Okay. So running units is like on the floor here at KRMC, for instance, you were the director for the CVICU.
Correct.
Cardiovascular Intensive Care Unit, right? I can
Correct.
get that right?
Correct.
Okay. But that's what brought you to KRMC to begin with.
Well, yeah. Initially, I used to work full-time with hospitals, and I was over critical care. I was over various units, you know, step-downs, mostly always critical care, and then other units. And then I had to, when my mother fell ill, I took a FMLA one time. And then since she was diagnosed with cancer, I resigned and spent some time with her.
Oh, okay.
That's when I actually transitioned to being a consultant.
Okay.
Because I knew I needed more time with her.
Sure.
And then I realized that I'm really good at what I do, and all the hospitals I worked with appreciated it. So I continued being a consultant, which gives me that flexibility also. So basically, I do anything a hospital requires.
Which is true now because you're transitioning between CVICU to administration for a while.
Correct.
Okay, and I know you were saying before the show, you're helping like with our EMR, the electronic medical record rollout, helping on the floors during that
Correct.
time period.
To support the directors of the units that we have,
Mm-hmm.
so that they can concentrate on them supporting the staff.
Very good.
We're working as a team to help support all that.
That's excellent, because this EMR has been a big thing. It's a huge financial commitment, obviously, for the hospital, but it's a major project that impacts patients in the hospital and outside of the hospital. Our staff, it's been a big learning curve for them, but the end result, of course, is going to be so worth it.
Absolutely.
You see that on the other side of it, just medication errors alone that will help reduce. Not to mention overall patient care, I think, will be improved.
It's a huge step, I think, in the right direction for sure.
Mm-hmm.
I mean, if I were a patient in this hospital, this is absolutely something that will help me as a patient, because no matter where I go, the old system was, let's say I go for a vacation to Florida,
right,
and I fall sick, you'd have to fax all these thick charts,
right,
to Florida before they can give me adequate care.
Right.
Now it's electronic.
So they can like just
as a
send
patient, it's a huge plus if I was a KRMC patient.
Right.
So I think it's great for the community that we have such a nice system in place.
Well, and and I'm always talking about how proud I am of KRMC, that we are so proactive and cutting edge, doing the latest and greatest, if you would, for a small community like Kingman to have
Right.
that kind of. There's a lot of hospitals across the country that don't have EMRs yet, right?
Right.
Or early in the
Early
process.
stages, yes.
Yeah. So it's pretty cool. I mean, obviously we know it's federally mandated, but we still were one of the first ones to say, okay, we got to do it. Let's do it and do it right. And I think it's something to be proud of. It's
Right.
a big thing. So let's talk a little bit about CVICU.
Okay.
It's Cardiovascular ICU, and that's, if I'm right here, part of our open heart program that
Correct.
we have here at Kingman, right?
That's right.
Which is another huge thing for a community this size to have an open heart program.
Correct.
Which is fairly new for KMC.
Correct.
In the past, we would have had to just life flight them.
Correct.
We wouldn't be able to do that. So what does CVICU do for those patients?
Before I answer that question,
Mm-hmm.
I would like to tell you that obviously I've worked in a lot of different hospitals across the country.
Right.
And I worked abroad in different countries. And so when they first asked me to work here, I didn't know. I mean, I looked at the map and I looked at Kingman and I said, okay, small place, community-owned hospital.
Yeah.
And I don't know if you know, but in general, if you look around the country at community-owned hospitals, it has a certain way of running. And
Right.
so my expectations were, it's like any other community-owned hospital, small town. When I came here, I was really surprised. It's one of the best equipped hospitals compared to any hospital in the country. I'm talking big, small, no matter who. So I was really surprised to see, first of all, that the equipment is new. I mean, our beds in the ICU are a year and a half old. Our
Right.
monitors are a year and a half old. So everything is ship-shape. Equipment is the latest. When I saw how the hospital is being run, I was even more surprised.
Wow.
Because usually community-run hospitals are not the best managed hospitals. This is phenomenal. I mean, you know the stats
Right.
that we're in our class, we're the best in all of the state of Arizona.
Mm-hmm.
And even if you include the big boys, we
Right,
came
like
ahead
Mayo
of Mayo.
Clinic. Yes, that's huge.
So that speaks for itself.
Yes.
But but I didn't expect that when I first came here. So I
And
was
that says a lot, because you've had such a broad experience with so
Right.
many different hospitals,
Right.
that for you to be impressed,
Yes.
that's impressive.
So I was very pleasantly impressed. I'm very impressed with the management, of course, and the administration of the hospital. Very open door policy,
Mm-hmm.
Now the CVICU, as you said, it is a huge plus for a community hospital of this size in a place like Kingman to have open heart surgery. We were fortunate to have an excellent surgeon.
Right, Dr. Montero.
Because that's what makes the difference.
Sure.
Dr. Montero, yes. And not only that, we have a very good team. I cannot tell you how glad I am that Dr. Lund works here. And this is a dedicated team that there are hospitals where you might hesitate to call people at night.
Right.
No problems here. You know, you can call the doctors at 2 a.m. You always get a response. They pick up the phone themselves.
Wow.
Which is the difference. You
Right.
know, usually often you'll have an answering service. And
Yeah.
so excellent service. CVICU program was started about a year and a half back.
Okay.
So it's not very, it's
Still young.
Yeah, still young. We've done a lot of cases. And we have excellent staff satisfaction and patient satisfaction.
Right.
If you look at the Press Ganey scores, a lot of them are at 100%.
That's great.
So I'm very glad with the results of those.
So the CVICU is where, like, after the patient has the open heart procedure, they're brought to CVICU for their first stages of recovery.
Correct.
And that's when they're in the most critical stages. with
So
blood
anyone who's
monitoring.
referred to this cardiovascular services is then brought into the CVICU.
Okay.
So sometimes we have patients who have not yet gone for open heart
Oh.
or a procedure.
Maybe
It's
they're
not
doing-
just open heart. We also do lobectomies,
What's
and when we take out a piece of the lung.
Oh, okay.
Right. Patients with cancer who the where the cancer is inside the chest
Okay.
would require cardiovascular surgery
Okay.
to treat that. So various conditions. Some people have infections inside, which require the physician to go in and, you know, clean it out and treat it, and maybe put a tube to get the fluids out.
Okay.
So all the cardiovascular cases come to this unit.
See, and I always just assumed that cardiovascular meant heart, but it's more chest.
Chest,
then.
yes.
Okay.
Yes.
That's good to know.
And so all those patients are taken care of there. They come obviously before surgery, once they consulted, once we're consulted, and then post surgery they come to this unit,
Okay.
and they stay there till basically, you know, they're good to go home or
Okay.
to wherever they're going.
Okay.
So we take care of the entire cardiovascular stay on that unit.
Okay. So when you're saying sometimes pre, so maybe if they need to be stabilized and condition improved some in order
Correct.
to have whatever the surgery is,
Correct.
so they can come in.
So they could
sooner.
come from the ER, they could come from another, they were in the hospital and their doctor realized that they have issues
more,
which cardiovascular needs to address, so they may get referred to us. They may come directly from Dr. Montero's office
Okay.
if they think you know, the patient needs procedures. And then the procedure is scheduled, and then we continue
Say
taking
that
care of them.
afterwards.
Till,
And,
yes.
and from what I've seen and heard, we have a really excellent results as well. So
Yes, it stands to reason. What I like also is that we do a combined team effort, which is every morning we have a rounds where the case manager, the social department, case management and social works, and the pharmacy.
Oh, okay.
We have great. We have actually a doctorate in pharmacy.
Yes.
Dr. Who comes to the
comes
rounds.
to the rounds with you.
There's Addie, who's the PA for Dr. Montero.
Okay.
She's in the rounds. So, and then the RT, respiratory therapy, they're there. So it's a multidisciplinary round that happens every morning. So we cover all the aspects of what's going on with the patient, what do they need. And then the director, such as myself, or we have Chris, who's on board now, we round on every patient every day
Very good.
to check on what their needs are.
Right. And you kind of keep the family in the loop as to what's
Yes.
going on, because I think
Correct.
that's also an important side
Very
of it as
stressful
well.
for the family.
Right.
So,
And
yes.
make sure that they are aware of what's happening for them as
Correct.
well. That's amazing, and it's something I'm very proud of that we have here at KRMC. So we're going to take a quick break, and then we'll talk about some of the things that you're doing right now, because I know you're transitioning to some other stuff.
Sure.
So stay tuned. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Bhrata Reddy. Thank you again, Bhrata, for being on the show.
Thank you.
We were talking before the break about our open heart program, and I know that Dr. Montero has been instrumental in making this program getting it open to begin with and making it such a success. And you were sharing some cool things about Dr. Montero.
Well, two things stand out to me. Like I said, I worked with a lot of different physicians, Like I said, the combination of Dr. Montero and Dr. Lund, I think
Dr. Lund is an anesthesiologist.
Correct.
Again, he kind of focuses on the heart or the cardiovascular.
Correct. He's also our chief medical officer in the surgery and anesthesiology. So the two things that stand out is number one is the amount of most doctors I've met are very dedicated, but these two stand out.
Wow.
Like I pointed out, from a nursing standpoint of view, you can call them any time of the night and day, and they pick up their own phone, and they'll answer any question, no matter what time of day or night.
Okay.
Second, they're so dedicated, they spend their life on that unit.
Wow.
So I don't have to worry about support from the physician or Dr. Lund. He's there, he comes, they check, not once, not twice, 50 times if necessary.
Wow.
But they're there.
Wow.
So which is such an awesome asset to have.
Right.
As opposed to somebody rounds and they disappear for the rest of the day.
Yeah, you don't see them.
Correct. Addie Bonds, their PA, is probably the best PA I've met in America.
Well.
And so the way she assesses the patients, her notes are the most thorough I've ever seen.
Wow.
So that's wonderful to have.
Right.
There's never any question. You read her notes, you know exactly what's happening with the patient.
Excellent.
So that combination, I think, is a huge, huge asset for Kingman.
And that's why I think it's important that our patients, their family members, know that they're in those kind of hands.
Correct.
That someone that really does care is going to provide them with the topmost care.
Correct. And there are two more things. One is physician related. I have rarely seen a physician like Dr. Montero who spends an inordinate amount of time sitting with the patients, explaining what the procedure is, why it's necessary, what are the choices, what will be the outcome, what prognosis to expect. Excellent. Because if I was a family member or a patient, that's what I'm hoping my physician will do, is spend that much time with me to go through this whole procedure and also what to expect and what will happen.
Help allay their fears,
Correct.
and because that's a big part of your healing too,
Correct.
is getting those fears.
And then the other aspect of it is if I'm a patient, I may be assured that I get great care in a hospital. My question is, what after that? Because I'm not going to spend the rest of my life in the hospital.
Right.
After a few days, I'll be home.
Yeah.
So my question as a patient is always, okay, I'm worried about what happens once all this is over.
And when I go home.
So in this case, Dr. Montero and Addie have their own clinic, and they're very thorough with their follow-up. They'll call the patient, you know, hey, how come you didn't come to the appointment? You have an appointment today.
Yeah.
So that's a huge plus again.
Absolutely.
So no matter where you live in, you know, if you came to this hospital, it doesn't matter where you live in Mojave County or wherever else in Arizona, these people keep in touch. They give you a number to call.
That follow-up.
So that confidence is there that, okay, I'm not worried, obviously, once I go home what to do. Now, the last piece that really makes this a great asset for us is the nursing care. You know, patients are admitted to a hospital only for one reason, nursing care. So if you take a second to think about it, everything else can be done outside the hospital.
Pretty much.
The only time you'll admit a patient is if we deem that they need nursing care.
Okay.
So in a hospital, nursing care is paramount.
Right.
That'll you know, be very crucial for the patient. And we have nurses. I've given several commendations to our nurses. These nurses are incredible. I mean, there was a patient who was not comfortable with the pillows we had in the hospital. Someone went out and bought from, I think, Walmart, or I don't know where they bought it, but they bought pillows that were soft enough for this patient, so this patient, she could rest, you know.
Wow.
My nurses have gone out and got puzzles for people. They've gone out and laundered clothes for people.
Wow.
They've gone out to make sure that somebody gets home safely. So I cannot tell you how many times or how many instances we have where our nurses have actually gone above and beyond any expectation of what a hospital nurse should be doing, just to make sure our patients are happy, are safe, or taken care of, or their families are felt
incredible.
supported.
So they really go above and beyond what the normal expectation for an employee for a nurse
Correct.
would be.
Correct. So not only are they technically savvy, but obviously admire this aspect.
They truly
that
care.
They truly care.
Yeah. It's that our mission of compassion and commitment, they put it into action. It's not just words. They make it
right.
a
And
real.
so honestly, it's a pleasure to work for them because it's so rewarding when people are actually interested in the patients and
makes
patient
your
care.
job easier, right?
Correct. Correct.
Which kind of can transition to your transition now. I know that Chris Laird is now back. You're helping him readjust into the directorship role there, but then
Correct.
you're going to be working with administration now and doing some training. I've already personally been able to come to some of your lunch and learns you're doing for managers.
Thank you.
That's a good thing. And so you're going to be working on special projects to help
Correct.
with what, customer service? What is?
There are several projects that they're interested in.
Okay.
I don't know all the details yet. I know I'm helping with the cath lab, doing a project that will be hopefully done pretty soon. Supporting leadership is one of them, and I've done a couple of lunch and learns. I've also done a couple of things for people who are new to leadership.
Okay.
Also
That's
some
really important because a lot of times people get a new role, kind of just rising to the top of it, but don't necessarily have the training to the good people skills maybe, or that. So
Right.
you're helping with those.
Correct. And administration will be sharing with me more concretely as to what other plans they have that they would like me to help with.
That's great. Well, we're
So-
blessed to have you here at KRMC and in Kingman. So are you enjoying Kingman?
Absolutely.
Yeah, it's a
Yes.
it is a big difference if you've come from a bigger city.
Right.
Yeah, but you're adjusting okay.
To be frank, it was a total change of scenery for me. I'm used to the Bay Area, New York, Houston, and so forth. So till now, my favorites have been Maine,
Oh, yeah.
where I've worked, and I still have good friends. And the Bay Area. I worked in the wine country. I worked in the
that's
Bay
nice,
Area
yeah,
itself, and I have friends there. So those two were my best, favorites. But when I came here, this place is so awesome in the sense it is stark, but it has its own beauty.
Yes.
You know, you can see for as long as far as your eyes can see.
Yeah.
Every sunset is magnificent, right? Yeah. I love the mountains.
Yep.
So it's very different. And honestly, I love it. I mean, Valley of Fire.
Yeah. Oh, you've been up there?
You've been
Yeah.
there?
Very
Oh,
good.
it's like another planet.
Yes.
And it's so beautiful.
Yeah.
I mean, I go up here to the Wallapai Mountains.
Yep.
Mount
Can
Charleston.
almost be like Maine for a little bit and then come back out, right?
So yeah, I love it. So it's quickly becoming one of the.
One of your topper choices.
I used to have 2 favorite places. Now it's 3.
3, very good. That's good. Well, I'm just impressed when you've shared how diverse your background has been and how many other facilities you've been in, and then to be here at KRMC and be proud of us. That's pretty cool. That feels really good. So what other things do you enjoy doing when you're not working? Because I know you're putting in a lot of hours, but do you get to have some fun once in a while too?
Yes, I love music.
Oh, okay.
Yes, and like I said, I love exploring this the area around Kingman. I've been to Sedona, which is gorgeous.
Oh, yes.
And Flagstaff, and I still need to explore Williams.
Okay.
Even Flagstaff, I've been there a couple of times, but I need to spend some more time. So exploring this area is definitely top of the list.
Good.
So when I get a good chunk of time, like on a weekend or something, that's what I'm doing.
Very good, yeah.
And then there's Monument Valley and so forth. Music has always been a passion.
Okay.
So I buy a lot of music. I listen to a lot of music every day.
So that's like your relaxation.
Correct.
Very good.
Right. Trying to get back into painting.
Oh, very good.
So
Good.
those are kind of the,
The
and then
yeah.
time with my cousins and family
Very good.
is very important to me.
Well, thank you so much for being on the show. I think we've maybe helped allay some fears and concerns people have about heart and issues here at KRMC. I hope you learned a lot today and that you'll be with us again next week when I'll have another great guest on the program for you.